Today we're going to talk a little bit about the treatment of frozen shoulder, rotator cuff problems. This can both be from overuse, from trauma, number of different factors. With this patient, we're more specifically targeting frozen shoulder in this treatment, and it's visit number 3, and we're slowly getting a little bit of an improvement. In this patient's case, her shoulder flexion was only about 30 degrees, 20 degrees when we started. It's a little bit better today, and that typically indicates the supraspinatus tendon, which is one of the 4 rotator cuff tendons that's the most implicated. In fact, in rotator cuff conditions, also frozen shoulder, the supraspinatus is one of the 4 rotator cuff muscle tendons, and that's the one that typically becomes mostly affected in 50-60% of shoulder problems. We had a little bit of heat from the heat lamp on the shoulder. With frozen shoulder, it's adhesive capsulitis. Everything freezes up and there's very little movement. Over some time, the synovial fluid in the joint capsule itself can get calcification, and the fluid sort of dissipates. So we really want to work on warming up the area. Points that I did today, an extra point called Jiane Ling, 2 shoulder joint points, specifically large intestine 15, Sanjiao 14, and a couple tender spots in the shoulder that I call large intestine 14.9, 14.8. And here's lung 3, and an extra point as well called Nao Shang. That's treats the deltoid. These ones here treat the shoulder joint themselves, and this the supraspinatus tendon that's the most sensitive and implicated in this patient's condition. I'll always do some Japanese style moxa called okyu with my rotator cuff patients, as well as with frozen shoulder conditions. The moxa treatment called mugwort is excellent at warming the area, creating circulation, even helping microtearing in the supraspinatus tendon, and also the adhesions that can occur in and around the area. I always describe this moxa as having laser-like penetrating effects with its pinpoint precision. I also describe it like an ancient laser treatment, because this heat penetrates deeply and very precisely like a laser, really helping to warm the frozen joint, move what we call qi and blood stagnation, which is improving circulation. In the case of rotator cuff condition, where this particular tendon might have some tendonitis, the acupuncture and the moxa decrease inflammation as well. And if there is any micro tearing, obviously if you're in excruciating pain with a possible complete tendon tear, please seek medical advice. But with what we call micro tearing and some adhesions, the acupuncture and the moxa can actually heal that micro tearing in the tendon. I'll do about 2 or 3 more times on each point with the Moxa. We'll turn the patient around, and then we'll continue showing some of the frozen shoulder treatment from the back. Thank you so much for watching. Please like and subscribe.